This is your statewide newscast, Arkansas Today.
Welcome back. We are talking about Heart Month, and joining us today, Kyle Harvey, a student with the Arkansas Pharmacist Association, and also Dr. John Vincent, to talk about American Heart Month, the importance of it. It affects so many people and sometimes doesn't get the attention it deserves.
It does. So heart disease is, of course, the #1 chronic disease that it's the most expensive, the most Americans suffer from heart disease, and it's the #1 chronic disease in Arkansas.
Wow.
Fortunately, many of the symptoms are preventable, and many cases of the disease are preventable, and we have pharmacists in all 75 counties in Arkansas that can assist folks. It's as easy as ABC, and Kyle's going to talk to you a little bit about those today.
Okay.
So when thinking of heart health, we like to remember ABC. DE. And so the A stands for aspirin. In some cases, a baby aspirin a day is very helpful for someone as far as preventing cardiovascular disease. And your local pharmacist, local healthcare provider can talk to you specifically on whether that would be an appropriate recommendation for you or not. We get to B, we think of blood pressure. In Arkansas and the United States, people's blood pressures are oftentimes too elevated. So we're really trying to be below 120/80 with our blood pressure. C, cholesterol. We like to eat fatty foods, salty foods, things like that. And it shows that the higher your cholesterol is, the more chance you have for your veins to develop plaque inside them, which can cause heart disease, stroke, heart attack, things like that. D, diet and exercise, D&E, diet and exercise. This is probably the biggest thing that we as a state, as a nation can do to help with the heart disease. Eating healthy foods, fruits and veggies, grains, low-fat dairy products, leaner meats, exercising. And when I say exercise, I don't mean you have to be at the gym 2 hours every day. You know, I'm talking 30 minutes, 5 times a week, brisk walk, just something to get your heart rate up. So that can be very helpful. And then also there's an S on the end, ABCDES, smoking cessation. Anything that we can do to get a cigarette out of someone's mouth will help their heart health. And there's actually a really cool program going on in Arkansas. About 30 pharmacies over the state are working with the health department and the Harding College of Pharmacy in Searcy to open up these new smoking cessation or helping people quit smoking programs in some pharmacies in Arkansas.
That's wonderful.
So there's actually a few here in Little Rock too. So there's a lot of things that we can do to help our heart health, and your local pharmacist can definitely help you and counsel you through that.
Go chat with your pharmacist about it. It's never too late. If you say, I've been eating bad too long, I've been smoking too long, it's never too late. You can still reverse some of that damage. Thank you both for joining us. We appreciate you.
We appreciate
Go talk to your pharmacist. They can help you out. We are back after this. Stick around.